Okay, y'all, we're gonna finish up this chapter and then we're gonna move into the vessels. I'm trying to get as close as I can. I'm not whispering, so hopefully y'all can hear. I'm just gonna start kind of where we left off, and we left off on the dysrhythmias with the pictures. We talked about the AFib being irregular. These are your heartbeat. This is your pulses, your heartbeat, and we're supposed to get a regular rhythm, meaning these points are supposed to be at regular intervals. And you can see how this is kind of one length is a little bit shorter, it's a little bit longer, a little bit shorter, really longer, shorter. So that's AFib, is really disorganized. We talked about another one, aflutter, which is kind of like AFib because it has to do with the atrium as well. Just not following the correct path of the electrical path, if you remember, SA node to the AV node and so on. But the rhythm is regular, so the points are going to be at regular intervals. And it looks, we talked about it like a saw, one of those saws that you cut the trees with. Okay, so you got bradycardia. Now, bradycardia is a slow heart rate, but it's also a slow rhythm. You can see up here where the points, so that would be 1, 2, 3, 4. Those are heartbeats, or those are, those are heartbeats or pulse beats. They're regular. They're the same amount in between, so that would be sinus brady, the rhythm. Tachycardia would be more than 100, so they're going to be a little bit closer, the points, you see, but they're still at regular intervals. They're still going at a regular rhythm. Okay, you got sinus dysrhythmia, variation in heart rate during breathing cycle, premature contractions, ventricular contractions, PVCs. Right here, you can see how it's regular. Now, it's going a little bit different, but there's still a PQRST wave. But you can see where the ventricle throws in an extra heartbeat, an extra pump. Fibrillation, cardiac muscle fibers are out of step, producing no effective pumping action. So lub-dub, lub-dub, lub-dub. That's at a regular rhythm. Here, the fibrillation is almost more like quivering, almost, kind of. And they're not going to a regular lub-dub, lub-dub rhythm. It's out of rhythm. So AFib occurs when there is mitral stenosis, when there is rheumatic heart disease, and infarction of atrial myocardium, meaning there's no blood flow or oxygen getting to the myocardium part of the atrium. Remember, the myocardium is the muscle that does the pumping. Ventricular fibrillation, or VFib, is life-threatening. It is an emergency. It's life or death. It occurs when the ventricles, so remember, you got the two bottom chambers, which are the ventricles. They pump blood to other parts of the body. Your left ventricle pumps it to the rest of your body so that the rest of our tissues, the rest of our organs can get the nutrients and the oxygen. If my ventricle is quivering, instead of doing a full pump like this, instead it's going like this, is not really pumping. There's no power behind it, no force. So that's dangerous because your organs will start shutting down in minutes. Defibrillation can treat fibrillation by applying an electric shock to force cardiac fibers back into rhythm. So, when you see that on TV shows and they go clear and they shock them, they're trying to stop it from quivering. They're trying to get it to go back to a normal rhythm. That's what the AED is, a little machine that we find on the walls, which we'll go through in CPR, but it's a lightweight device. It detects, when you put on the pads, it'll detect the heart rhythm and it'll tell you if that patient needs a shock or not. And then it'll guide you from there. Atrial ablation is used to treat atrial fibrillation by destroying heart muscle in a specific location and eliminating the pathway of abnormal electrical signals. So your electrical signals are supposed to follow a pathway, right? But when there's other parts of the muscle and it's going, instead of going this way, it's going this way and then like that, right? So those, you're getting two electrical signals instead of just the one that should go out of rhythm. So if they can remove that part of the heart that's taking that extra signal, well, then that pathway has no choice but to go through that regular pathway as it's supposed to. Stroke volume, cardiac output. Stroke volume is the volume of blood ejected from one ventricle with each beat. So stroke volume, it is, the left ventricle. Every time it pumps, it opens, it pumps out, it squeezes and pumps out blood to the rest of the body. The left one does. And then it opens, relaxes, and fills with blood. And then it pumps that blood out to the body and so on. That's your stroke volume, the amount of blood that is being pushed out of the ventricle when it contracts to the rest of the body. Cardiac output is the amount of blood that one ventricle can pump each minute. So, stroke volume is the amount of blood the ventricle is pushing out every time it dubs. Every time it opens and pushes out and closes, every time it pushes out the blood to the body, the stroke volume is how much blood is pushing out for every pump. Your cardiac output is the volume of blood, the amount of blood that it is pumping each minute. So all the heartbeats put together, all the blood that is pushed out of the ventricle for the whole minute, each heartbeat will be your cardiac output. Stroke volume is the amount of blood that is pushed out for every time the ventricle pumps. Cardiac output is the amount of blood that is pushed out in a full minute. That's it. Average is about 5 liters per minute at rest. Cardiac output is determined. So in order for us to get the cardiac output, how much is pushed out every minute, we have to take our stroke volume, which is the amount of blood pushed out for every beat, and times it by the heart rate. Our heart rate is usually about 72 beats per minute, so it would be 72. The stroke volume for a normal healthy heart is going to be about 70. And then even then, the ventricle doesn't push all the blood out. It leaves a little bit in there, so we'll say 60. So you would multiply 72 times 60, and that would give you the cardiac output, which is the amount of blood that is pushed out over 1 minute. Okay, our heart rate is controlled. Well, there's different things that control it because we have two cardiac centers. One, two, I think it's two cardiac centers. It could be one. I think it's two. In the medulla oblongata, but our autonomic nervous system can alter the heart's rhythm to increase or decrease heart rate. Remember, when we went through the nervous system, you have the CNS, the PNS, and then part of the PNS is your ANS, which is your autonomic nervous system. That breaks down into sensory and motor, and then that breaks down into parasympathetic and sympathetic. So your parasympathetic relaxes your heart rate, your sympathetic increases your heart rate, increases everything. So your autonomic nervous system can change the rhythm of your heart rate. When blood carbon dioxide levels get higher as you exercise, because CO2 is also a byproduct. When you work out, you build more. And that's why your breathing gets fast, because you're trying to blow off the CO2, aside from being tired. You're trying to blow off that CO2. So when blood CO2 levels increase with exercise, the heart rate will increase as well to try and restore homeostasis of the blood gases. So balance of the blood gases, because we have an increased amount of CO2, which is a byproduct of exercise. Our breathing speeds up so that we can try and blow off that CO2 quicker, and we can take in more oxygen quicker to be able to oxygenate our muscles. And again, this is going to be your parasympathetic and your sympathetic trying to maintain homeostasis. And then here is your body trying to restore homeostasis with your gases, your CO2 and your O2. Sudden drop in blood pressure can increase heart rate to restore normal blood flow. So if my blood pressure were to drop, usually when your blood pressure drops is due to not having enough volume in your blood vessels. Because remember, your circulatory system is a closed system. It must have enough blood to fill the diameter of those vessels. So that gases can be exchanged. So if I don't have enough volume, my blood pressure is going to drop. My heart rate is going to speed up because I don't have enough volume. I don't have enough blood. If I don't have enough blood, I don't have enough blood circulating to oxygenate all my tissues. And my heart speeds up because it's trying to get the blood that it does have out to the body quicker. Okay, back to stroke volume. The volume of blood ejected by the ventricles is determined by the volume of blood returned to the heart by the veins or venous return. So remember, when our blood, we went through the flow of blood and we said once, which we'll get to in the vessels, but once all the oxygen is taken from the blood, it now comes into the veins. And remember, the superior and inferior vena cava bring deoxygenated blood, meaning it's that bluish color, which really is not, but in our veins, it brings that deoxygenated blood back to the right side of my heart. And depending on how much is returned, how much comes to my veins into my superior and inferior vena cava into my right atrium. So depending on how much of that blood is returned to my heart, the volume of blood ejected by my ventricles is determined by the amount of blood that comes back to my heart from my veins. Which is all your veins into that empty into your superior and inferior vena cava. The higher the venous return, the higher the stroke volume. So the more blood that I have coming back to my heart, the more blood my left ventricle is then going. And well, no, let me not say that. The more blood I have returning to my heart, is going to increase the amount both my ventricles push out, because my right ventricle is going to push the blood to the lungs and as much as it can to get as much as it can oxygenated quicker. And then there'll be more blood that the left ventricle pumps out to the body as well. Strength of your myocardial contraction also helps determine stroke volume. So remember, your myocardium is your muscle of the heart that is down there by the ventricles and is thicker on the left side because that left ventricle pumps blood to the body. So if that muscle is strong, it's going to have a very full force. It's going to have a good effect and is going to probably push majority of that blood out the ventricle. So that's going to also help determine your stroke volume. Valve disorders, which we'll get to in when we get to the veins, but your veins have valves, and when those, I'm sorry, not those. Valves in your I am so sorry, I'm thinking ahead. Valves in your heart, the mitral valve, the semilunar valves, and the AV valves. Coronary artery blockage and myocardial infarction can all decrease your stroke volume. So if I have valve disorders and my valves are not working properly, that's going to decrease the amount of blood that's pushed out by my ventricles, which is going to decrease my stroke volume. Coronary artery blockage, meaning the coronary arteries, is the heart's blood supply. And if you block that, the myocardium is not getting any blood flow, and that muscle is going to weaken and die, so the force is not going to be as strong, the contraction. Same thing in myocardial infarction. If I'm having a heart attack, it's that muscle that's affected, because that's why I'm having a heart attack, then it's definitely not going to work properly and give a full force of blood. Heart failure, inability to pump enough return blood to sustain life. It can be caused by many different heart diseases. Right heart failure is your failure of the right side of the heart to pump blood, usually because the left side of the heart is not pumping effectively. So typically, if the heart starts to fail, the left side will fail first and then the right side, because the right side is trying to do a lot more pumping. And it gets weakened and tired out. Things are not working properly. But this is where critical thinking comes in. Okay, this is why it's important to know the flow of the heart. If I get right-sided heart failure, right, we talked about the return of the blood. The blood comes from the superior and inferior vena cava. Deoxygenated blood comes from the vena cava, and it empties into the right atrium. From the right atrium, it goes down the tricuspid valve to the right ventricle. If my right, and then that ventricle then pumps it to the blood, to the lungs, to be oxygenated. If that right ventricle, if that right side of the heart, my right atrium, my right ventricle is failing, is not working properly, that means when that ventricle receives 70 mLs of blood, it's not going to eject the whole, shoot out the whole 70 mLs of blood because it's failing. It's only going to eject maybe, let's say 50. So that 20 ml is left in that right side of the heart, right? And then the atrium dumps another 70 mLs on top of that 20. So now we have 90. And again, that right side is not pumping properly, so it pumps out 50 again. So now we're left with 40. So that blood starts to back up because the right side is not pumping it properly. If that blood starts to back up from the right ventricle, it'll start backing up into the right atrium. From the right atrium, it's going to back up into your superior and inferior vena cava, and that's going to cause extension of the veins. Okay, so they're going to look swollen, hence why we look for JVD. There is a vein right there. If my heart is failing my right side, that fluid is going to be pushed up the veins, is going to be pushed again, it's going to flow backwards because it has nowhere to go. So knowing the flow of the heart from the right side of the ventricle, again, up the tricuspid valve into the right atrium, into the superior and inferior vena cava, and all the other veins are emptying into the vena cava. So now my JVD, my jugular vein, is distended because I have fluid that my right side cannot pump out to my left side, so my left side can pump it out to my body. Okay, same thing with left side. If my left side is failing, I'm going to have fluid backing up from my left ventricle into my into my bicuspid valve, into my left atria. From my left atria is going to back up into my pulmonary veins. From my pulmonary veins is going to back up into my lungs. Am I supposed to have fluid in my lungs? I'm not. So when that fluid and that blood is building up in my lungs, you're going to hear that when we listen. Hence, while we're listening to breath sounds, you're going to hear like crackles. It's going to sound like literally water fluid in the lungs. Okay. So left heart failure, inability of the left ventricle to pump, resulting in congestion of the systemic and pulmonary circulations. Diseased hearts can be replaced by donated living hearts or by artificial hearts implants, although both procedures have yet to be perfected. Okay, now we're going to move on to the next chapter. Okay, I'm going to also follow in the book. That is chapter 15. Now this is going to kind of all come together. Remember, we went through the blood. We went through the erythrocytes and what they do, the leukocytes and what they do, the thrombocytes and what they do. We talked about the plasma and how it contains all those proteins, right? And so that blood has to be distributed to the tissue so the tissues can get oxygen, and it's distributed by using freeways, which is your blood vessels, your arteries, and your veins, right? But in order to have momentum, in order to be moved like a roller coaster, it needs to be pushed. It needs to be turned on, and that's the heart. Okay, so the heart pumps all that blood, your erythrocytes, leukocytes, thrombocytes, through these freeways, which are your arteries and veins, and it is a closed freeway. Nothing can enter. No, nothing can come on the on-ramp. Nothing can exit. Everything stays in a one-way. It's like downtown. It is all one way. It is flowing one way. Okay, so we have our major ones are arteries, veins, and capillaries. You have arteries, which carry blood away from the heart. Majority of arteries are oxygenated blood, with the exception of the blood flow through the heart, which we talked about, right? The blood carries the blood from the deoxygenated blood from the right side of the heart to the lungs. So I don't want y'all to get confused that arteries are always red, are always carrying oxygenated blood, and veins are always carrying deoxygenated. That's not the case, because we got the exception in the lungs and the heart. But arteries carry blood away from the heart to the capillaries, and veins carry blood to the heart away from the capillaries. So again, it's a closed system. Your capillaries carry blood from the arterioles to the venules, which we'll get to. Okay. I'm looking in your book. I'm looking at page 414. We talk about the blood vessels, which we just did. Actually, okay, because it kind of went ahead. I really don't like that. But where are the... Okay, looking in your book, I do want y'all to know this, because it's not on here. But looking on page 414 under blood vessels, under types, you see where it says arteries. A little bit lower, it'll say arterioles. Then it'll say capillaries. Then it'll say venules. And then it'll say veins. What I need y'all to understand is that is the pathway. So our heart pumps our blood to the aorta, which is an artery. It carries the blood away from the heart, the artery, and it takes it down where it breaks off into the different organs, into different arteries, which delivers oxygenated blood to the organs. The renal artery delivers blood to the kidneys, and then you got the hepatic portal system, which takes some of that, takes blood from another one. But you have your bigger arteries, and then they go into smaller arteries. So oxygenated blood from the aorta goes down the aorta, which is an artery. It hits the arteries, and as it gets smaller, they turn into what we call arterioles. Those are smaller arteries, but still oxygenated and still carrying blood away from the heart. Then it goes from the arterioles to the capillaries. Capillaries are the smallest of the vessels and the thinnest, and this is where exchanges happen. Gas exchange, nutrient exchange, waste exchange. Once all the oxygen and nutrients are exchanged, because remember, in order to give you oxygen, I need my payment, right? So I make the drop, you give me my payment, and that's where that happens in the capillaries. Aside from the lungs, this is also where this happens. O2 is dropped off, CO2 is picked up in the capillaries, nutrients are exchanged, okay? So once oxygen is drawn out in the capillaries, deoxygenated blood then moves from the capillaries to venules, venules. This is in your book too on page 414. Venules, which are veins but smaller. Then it goes from the venules to the veins, okay? So from arteries to arterioles to capillaries to venules to veins. Arteries carry blood. Okay, we said that. So talking about arteries, these have 3 layers. This tells you exactly where they are, y'all. They're all tunica, tunica, tunica. intima, inside. This is going to be the inner layer of your vessels, which are made of endothelial cells. Endo. Tunica media, M, middle. This is your middle part of your arteries, your middle layer. Your media, it is smooth muscle. This tunica media is thick in your arteries. It has some elastic tissue to be able to stretch and recoil. It's important in blood pressure regulation. Tunica externa, external, y'all, is the outside. So it is the outer layer of fibrous connective elastic tissue. So your arteries have 3 layers. Your tunica intima, which is endothelial cells. Your tunica media, which is smooth muscle. And then tunica externa, which is fibrous connective tissue. Then you have your capillaries. Remember, it goes from arteries to arterioles to capillaries. These are very, very, very small vessels, and they only contain 1 layer. We call it the tunica intima, and I assume that's because it's made of endothelial cells as well, most likely. But again, 1 layer because this allows for gas exchange, nutrient exchange. Tunica intima, so veins. Veins also have 3 layers. Tunica intima, again, the most inner layer. Now, veins have something that arteries don't, and they have valves because the heart pushes the blood, and because it's so forceful, there's a lot of pressure. That blood makes it makes it all the way to the head and all the way down to the body. But by the time it hits the arterioles, to the capillaries, to the venules, to the veins, it kind of loses momentum. It needs more push, right? But there's no heart in the middle to kind of help give it that push, like the Mario go-kart. There's no arrows to help give that blood that push. So to try and get the blood all the way from the feet, which has already lost momentum, to try and get it all the way back up to your heart so that it can be oxygenated and pumped again, we need help. And that your veins have valves. Okay, so they work so that the blood flows up the vein, and then the valves close so that it'll keep the blood from leaking back. And then the blood flows up, and there's valves up here that hold it. And then the blood flows up, and then there's valves up here that hold it. But the valves keep the blood flowing in one direction, and it keeps it from leaking back. Tunica media, again, is your middle. It's your smooth muscle. It's not as thick in your veins as it is in the arteries. Because in the arteries, again, this is what helps in blood pressure. There's not a lot of pressure in your veins because, again, it's lost some momentum as it's traveled through as much as it has. Then it has the tunica externa, which is a thicker layer of fibrous connective tissue. So you have your intima, which is endothelium or endothelial tissue. Okay, these are your valves to keep it from flowing back. Then you have your smooth muscle right here. You see how it's thinner and this is thicker. And then you have your externa. My arteries are distributive arteries. They distribute nutrients, gases, and other things. They're carried in the blood by way of high pressure. They assist in maintaining the arterial blood pressure. They serve as blood reservoirs. Let me find this in the book. Keep y'all up. Okay. In the book, 416, arteries and arterioles distribute blood from the heart to the capillaries. In addition, by constricting, dilating arterioles, they help maintain adequate arterial blood pressure. So our body constantly, again, is trying to maintain homeostasis, right? Especially with gases, with pressures, with fluids, with all of that stuff. And in order to control some pressures, right? that smooth muscle in these veins and these vessels that I'm showing you, they contract. If my blood pressure is low, they're going to contract to try and make it, because remember, resistance causes high blood pressure, causes pressure to go up because it's resisting and it's causing the heart to work harder and to put more pressure to try and get the blood to go through that constricted vessel. If my blood pressure is too high, my vessels, that muscle tries to dilate to allow more blood flow so that there's less pressure and less work on the heart. But we also need pressure because that pressure causes nutrients and gases to be pushed out in the capillaries and to other things to be pushed in as needed. Without that pressure, gases, nutrients, all of that would not be able to be exchanged between the capillaries and the tissues. Capillaries serve as exchange vessels for nutrients, waste, and fluids. So they exchange, again, nutrients, waste, and fluids. Veins, they collect blood for return to the heart. This is a low pressure flow of blood because, again, the heart, the momentum has given out by the time the blood gets to the veins. Okay, so we go from the heart to the aorta to the artery to an arterial. Here, this is where water by osmosis, right? Water is being pushed in. Things are being pushed out. And you're going from the artery to the arterial to the capillary right here where gas exchanges. And in here, again, osmosis and oxygen has been taken up. So now, it's bluish because it has no more oxygen. Okay, when fluid is pushed out of the capillaries, because maybe you have too much fluid, or for whatever reason, it's pushed out, the lymphatic system, which we'll go over later, is right there to absorb all that extra fluid. All right, disorders of arteries. Arteries must withstand high pressure and remain free of blockage. Arteriosclerosis, hardening of my arteries caused by calcification of fatty deposit on arterial walls. We kind of talked about this earlier. So when we eat a lot of fat, so our vessels need to be a certain diameter, right? Because our body's constantly trying to maintain homeostasis. It needs to be a certain width, a certain diameter for the blood to just flow smoothly. It needs to be not too tight, not too loose, because we need that blood to fill in the whole diameter of the vessel. So when blood is used to flowing through these open vessels with no problem, our pressure is regulated. But when you start to build fat, you start to close off that diameter. If it was used to flowing through easily through a diameter of 10, but now you're adding all this fat, now my diameter has come down to 6. So my blood is like, what's going on? I can't flow through this as easily as I used to, right? So now we're causing less blood flow to the next organ, which is typically going to be your heart or something. But less blood flow than what I'm used to because my diameter has changed, because now there's fat building up on these walls, and that fat is causing my vessel in this area to be hard, not to be able to move the way it's supposed to. This reduces blood flow, possibly causing ischemia. Ischemia is death of your tissues that may progress to necrosis, which is complete death. Ischemia is lack of oxygen to the tissue, and then necrosis is when it's already dead. May be corrected by vasodilators, meaning I'm going to take something that's going to make my vessels open, relax and open, to try and get back to a diameter of 10 or whatever it is. Angioplasty is mechanical widening of the vessel. So I might go in there, they might go in there surgically and put a balloon or put something here that's going to push, either scrape this out or push that fat up against the walls which isn't going to help. It's only a short fix. Push it against the walls to flatten it, to make that diameter closer to a 10 like my body is used to. Atherosclerosis is lipids and other matter block the arteries, so same thing. Arteriosclerosis is hardening, and that's because this turns hard. Atherosclerosis is when it's blocking, but maybe it's not hard. Balloon angioplasty. They open the you can see where all the fat is right here, and you see blood flow can flow through that. So they go in, they open a balloon, and they push the fat to the sides, which is done. An aneurysm, abnormal widening of your anterior wall, promotes formation of thrombi that may obstruct blood flow to vital tissues. Thrombi, blood clot. Which if we have a blood clot in the way, then my blood is not going to get through to the rest of my organs. Arterial walls may burst, but because of that blood clot and the pressure being put behind it, that artery might burst, resulting in life-threatening hemorrhaging, meaning I'm bleeding out. They need to save me quick, because when there's a cut in my circulatory system, because again, it's a closed system, that blood is leaking out. So there's less blood flow that's going to my organs, and my organs start to shut down. CVA is a stroke, ischemia, or lack of oxygen to the brain tissue caused by a moving blood clot or a hemorrhage, a bleed. All right, disorders in my veins. Veins are low pressure vessels. Again, there's not a lot of pressure. Think about it when you walk. Every time you walk, you take a step, you're assisting and pushing your blood flow back up to your veins. And then your skeletal muscle will massage your veins to also keep the blood flowing upwards in that one-way direction. In the meantime, then your valves open and close to keep that blood from going backwards. So veins are low pressure vessels. Varicose veins, enlarged veins in which blood pools. So my veins are going to get wide, and my blood, because gravity is going to pull, and there's not a lot of pressure to push the blood up back to the heart, then my gravity is going to pull that fluid down, and it's going to start to pull in my lower extremities. Hemorrhoids are varicose veins in the rectum. They pop, they come out, they hurt, they itch. Treatments include supporting affected veins and surgical removal if there's a lot and they've tried other things. Thrombophlebitis is vein inflammation accompanied by a clot formation, which may result in fatal pulmonary embolism. So if I have an inflammation of my veins and things start to clot, which is a thrombus, that clot could then be broken off and is now an embolism, and it can make it to my lungs, which is now pulmonary embolism. That's a normal vein, but you see the vein has widened, that the valves are no longer touching, they can't close, so that blood is pulling, hence that. Systemic and pulmonary circulation. So blood circulation refers to the flow of blood through all the vessels, which are arranged in a complete circuit or circular pattern. Systemic circulation. Okay, that's systemic circulation. This carries blood throughout the body. So you go from, again, your left ventricle through the aorta to your smaller arteries, arterioles, capillaries, venules, vena cava. Well, venules, veins, vena cava, and right atrium. We went through that. All right, pulmonary circulation. This carries blood to and from the lungs. So pulmonary circulation just has to do with your lungs. Your right ventricle pumps it to your pulmonary arteries into your lungs, where it gets oxygenated, where it says, give me my payment of oxygen, and we'll make the drop of CO2. Path goes from right ventricle, we read that. Hepatic portal circulation. This is unique blood route through your liver. Your vein, hepatic portal vein, exists between two capillary beds. This assists with homeostasis and blood glucose levels. So there are arteries in here, right? And these are taking the oxygen. And once the oxygen is taken, it's emptied into your venules, into your veins, which are here. And you can see where blood in every part of your large intestine is emptying. into these veins. Okay, that's what I thought. Okay, so this is taking blood from your GI and your liver and from all these organs, okay? It goes through, again, 2 capillary beds in order to make sure that everything is oxygenated. Because the liver also needs to put waste in there. So it pulls out the oxygen, it goes through capillary beds, and it goes through 2 of them. That's what you need to know. It exists between 2 capillary beds. Usually it goes from the arteries, arterioles, to the capillaries, to the venules, to the veins. That's what I need you to know. Fetal circulation refers to circulation before birth. Modifications required for... Okay, so this is us. This is our... No, no, no. No, no, no. Okay. Sorry, y'all. So, first thing I want to get out there is shunt. When we say shunting, like when we put a shunt in our arm or fluids are shunting, that means it's moving abnormally. It's shifting to one side. It's like shifting to one side, okay? It's moving to one side. But when it moves to one side, it goes by it shunts to one side by way of a shunt. When we put a shunt in our arm for dialysis, we're shunting. It is a shunt because we're shunting the blood through something else away from the original. Okay, so in fetal circulation, because they're in the belly, right? They're not breathing air. In order to get oxygen and stuff, nutrients to their lungs, they are swallowing amniotic fluid, and that's going to assist in their lung growth. Okay, their liver is also not doing any breaking down, so it's not working as hard as it will once they're born, because it's not breaking down blood cells just yet. It's not breaking down sugars. It's not storing sugars. It's not doing things that it will do once the baby is born. Okay, here as well, again, our lungs just need a bit of blood supply to be able to grow, so that when the baby is born, they are functioning properly. But it doesn't need so much oxygen to do gas exchange, because in a baby, there is no gas exchange. It is not breathing to get gas exchange, okay? So that's the first thing to understand. Shunts in blood circulation and in fetal and baby circulation in utero, when it is still inside the lady's womb, okay? There are going to be 3 shunts. You have your ductus arteriosus, your foramen ovale, I call it ovale, some people call it ovale, and then you have your ductus venosus. Now, these are all shunts. These are all going to take blood and shunt it away like a shortcut to continue circulation. So again, our liver only needs enough blood to provide it with nutrients to be able to grow, so that it can function properly once the baby is born. It's not doing any breaking down, so it doesn't need a lot of blood supply to do any breaking down, right? So your ductus arteriosus, you see, is right here. So usually in the normal human, its blood flow is going to flow and is going to go through your hepatic portal system. But because the liver doesn't need that much blood, it's going to bypass the liver and shunt some of the blood over to this, which is your umbilical cord, and it's going to send blood upwards. So it's bypassing. Now we have the foramen ovale. I'm sorry, y'all. Ovale, this is another shunt. This is a hole in the heart. This is that hole in the heart that I was talking about that you might hear a murmur. If that hole does not close, people can live with it, but you may hear a murmur, which is like a swooshing because blood is going through that heart, which it shouldn't be, through that hole. That is your foramen ovale. So because the right ventricle doesn't need to pump so much blood to the lungs because it's not doing gas exchange, it pumps from the right atria straight into the left atrium, into the left ventricle, and up. Okay. And so blood mixes. And so again, because it doesn't need to pump all that blood to the lungs, it shunts the blood from the right atria to the left atria through your foramen ovale. Your ductus arteriosus, again up here, because your left ventricle doesn't need to pump, your right ventricle doesn't need to pump so much blood to the lungs. It also then pumps, when it is pumping to the lungs, there is your ductus arteriosa connected to the aorta, and it's going to join the aorta and go to the rest of the body instead of to the lungs. So it's going to shunt the blood again away from the lungs into the aorta and just hit the rest of the body. That's your ductus arteriosus. Defining blood pressure: push or force of blood in the blood vessels. Exists in all blood vessels, highest in arteries, lowest in veins. Again, we talked about this because the heart is forceful, is pushing through the arteries, and once it reaches the bottom, gravity kind of has its effect, and once it hits the veins, it's lost all that force, all that pressure behind it. Exists in all blood vessels, highest in arteries. Blood pressure gradient causes blood to circulate. Liquids can flow only from areas of high pressure to areas of low pressure. Low or non-existent blood pressure gradient is fatal if not reversed. Hypertension can cause a blood vessel to rupture. Okay, my blood volume. If I have too much blood volume, right? The larger the blood volume, the more fluid I have, the more pressure that's going to be exerted on my vessel walls. The strength of heart contractions. This affects my cardiac output. My stronger heartbeat increases my pressure. A weaker beat decreases my blood pressure. Heart rate is increased. Heart rate. Increased rate. Pressure, decrease rate. Increased rate increases pressure. There we go. Decreased rate decreases pressure. For blood volume. Blood viscosity. If my blood is thick, right, my heart is going to have to pump harder to push that blood through my vessels. That blood is thick and is going to hit the vessel walls harder as well. It's almost like just having a heavy hand. I know when I got tattoos, I got one on the back of my neck and one on the back of my lower back. That one on my lower back hurt so bad, and I would say he has a heavy hand. That's kind of like this blood viscosity, because the blood is so thick. The heart is pumping harder to try and push it through the vessels, and it's exerting that blood. That thick blood is hitting the vessel walls harder, causing more pressure. So blood viscosity, less than normal viscosity, decreases the pressure. So the thinner it is, the more like water it is. It's not going to fill up that diameter, and there's not going to be any pressures being exchanged, or anything being exchanged, because the pressures are low. So we don't want the viscosity to be too thin like water. Greater than normal viscosity increases pressure, which we just talked about. Resistance to blood flow. So when my vessels, we said my arteries and my veins, but my arteries have smooth muscle, your tunica media. It is made of smooth muscle, and that is what controls your blood pressure. That is what controls dilation and constriction of your blood vessels. So when when our blood is used to going through a diameter, I'm just throwing out a number, a diameter of 10, and then our smooth muscle in our arteries decides to constrict and become a 5, we're going to now have resistance to the blood flow because the blood is used to flowing at 10. Now it has to flow through 5. So all that stuff is going to back up. But again, that is resistance. The heart has to pump harder to try and push that blood through that vessel. There's your diameters. I don't know how many slides we got, but this is a lot. Okay, blood pressure varies within normal range from time to time. Central venous pressure influences pressure in large peripheral veins. Venous return of blood to the heart depends on 5 mechanisms. So, venous return of blood to the heart, meaning the blood that's coming back, venous return, the blood that's coming back, that deoxygenated blood coming back up through the veins into my heart. A strong beating heart. So if my heart is strong enough, then when my blood gets to my veins, it may not lose that much momentum. It may only lose a little bit momentum, but still flow pretty good up against gravity through my veins with the help of my valves. An adequate arterial blood pressure, valves in the veins, working valves, pumping action of skeletal muscles as they contract, because again, as we walk, our muscles contract, but we're putting pressure on the bottom of our feet, which helps push blood up. And then as we're walking, our skeletal muscles contract, also massaging the blood up our leg. Changing pressures in the chest cavity cause, nope, we'll leave that alone. Pulse. Alternate expansion and recoil of the blood vessel wall. There are 9 major pulse points. Y'all should know those. Hypertension occurs when blood pressure exceeds 140/90. 90% of hypertension cases are primary, essential, or idiopathic. Remember, idiopathic is I don't know. It's unknown. Secondary hypertension can be caused by kidney disease or other causes. Many risk factors for hypertension. So what puts me at risk for having hypertension? Why might I get hypertension? This could be genetics. Maybe my mom, my dad, my grandma, my sister, my grandpa all have hypertension. My age as I get older, my stress levels can cause high blood pressure. Obesity can cause high blood pressure. Smoking can cause high blood pressure. Eating unhealthy can cause high blood pressure. Eating a lot of salt can cause high blood pressure. Untreated hypertension may contribute to heart disease, kidney failure, and stroke. Shocks, circulatory shock. So shock usually happens usually due to low blood pressure. There's not enough blood volume being circulated and your organs start to shut down. So the main thing about shock is that your organs are starting to shut down because there's not enough blood flow. There's not enough fluid in the circulatory system. Failure of circulatory system to deliver oxygen to the tissues adequately, resulting in cell impairment. Cardiogenic shock is caused by heart failure. So when my heart starts to fail and it's not pumping enough blood to the tissues, then my organs start to fail. I don't have enough volume in my circulatory system to be able to distribute enough oxygen to the tissues. So my organs start to die, my tissues start to die, my cells start to die. Hypovolemic shock is a drop in blood volume that causes blood pressure to drop. So because there's a low blood volume, hypovolemic, hypo is below, volume. Volemic is volume. That causes blood pressure and blood flow to drop, often caused by hemorrhage or loss of interstitial fluid, causing blood plasma to drain out of the vessels. So just what it says, because I don't have enough blood volume, I don't have enough oxygen circulating, so my organs are not getting enough oxygen. My organs are going to shut down, my tissues are going to shut down, my cells are going to stop working. Neurogenic shock is caused by nerve condition that relaxes the blood vessels and thus reduces blood flow. This occurs when sympathetic stimulation is disrupted. A lot of times you're going to see this with paraplegics. But again, what happens is because your sympathetic system is kind of out of whack, when the blood vessels relax, so if my diameter is used to 10, but as my vessels relax, they're going to relax and widen, right? So now I'm at a 20 instead of a 10, and there's not enough blood to fill up that vessel to cause any pressure for exchange, right? So my blood vessels, when my diameter gets wider, when they dilate, when my vessels dilate, my diameter gets bigger, and now I don't have enough volume filling that up, so my arteries can't massage the blood, can't continue pushing that blood. So now there is less blood flow, and now again my organs start to fail, my tissues start to fail, my cells stop working. And this happens again when my sympathetic is disrupted. Anaphylactic shock results from an acute allergic reaction called anaphylaxis. This causes the same kind of blood vessel dilation that occurs in neurogenic shock. So, you're allergic to something, your lungs start to swell up and you can't breathe because your body's trying to help get rid of it. It's really trying to protect you. But then my vessels relax and dilate. And again, now I have no pressure. There's not enough blood to fill up my diameter. So my vessels cannot push that blood around to distribute oxygen to my organs. My organs start to die. My tissues start to die. My cells stop working. Septic shock results from complications of septicemia. Emia means blood. Bacteremia, septicemia, that means blood. Hypoxemia, toxins in blood resulting from infection. Toxins dilate blood vessels, including inducing shock. Same thing. My vessels are relaxed, not enough blood. Ooh, all right, y'all. That's it. Now, I'm going to let something out, and I thought it was going to be tonight. It's not, but it'll be tomorrow. Make sure when I let it out, you do it, okay? Please go back and read your heart chapters. You need to know the heart flow. You need to know your red blood cells, your erythrocytes, erythrocytes, leukocytes, and thrombocytes. And then, yes, your lymphocytes, monocytes, neutrophils, basophils, eosinophils. You need to know gas exchange diffusion. You need to know how we drop off. We make the drop and we pick up payment, right? We need to know our anemias. We need to know how the heart pumps the blood, the flow of the blood through the heart. We need to know how the electrical system works, your SA node, AV node, I think is bundle of His, and then Purkinje fibers. So please study hard. If you have any questions, please email me or talk to me tomorrow.